Dr. Ricardo was referred to me by a service in Portugal called Serenity.
Okay.
Since I'm an immigrant here, we subscribe to them, and they went out and did their research and recommended Dr. Ricardo for being my orthopedic doctor.
Okay.
And I would say we had our first appointment in January of 24, early February, late January.
Mm-hmm.
And immediately a couple things that impressed me. One was his knowledge and comprehension of my situation with my knees. A big factor also was he does speak English well.
Yeah, he does.
Which is, kind of important for us.
Of course.
But, I would say we went through all the steps of how to progress to make the right decision to replace my knee. And it was through, over a period of from that February to really the end of May that we went through various scenarios of different treatments and arrived at the decision that to replace the knee.
Okay.
And once the decision was made to replace the knee, I will say that Dr. Ricardo did a tremendous job, and I will use comparisons from here to the U.S. We decided in June 1st to replace the knee, and by June 26th, we had the procedure done. And in that time frame, we went through appointments with cardiologists, with anesthesiology, blood specialists, and we're able to do that. In the U.S., that procedure would have taken at least 90 to 120 days.
Okay.
So he was able to get everything lined up and get all the doctors done. And we did the procedure on June 26th. It was a very successful procedure. 3 days later, it was a Wednesday, Saturday morning, I left the hospital and I was walking without crutches, I would say, within 10 days. And a testament to the success of that procedure is that in the year since the year after the procedure, I biked over 6,500 kilometers, which is a testament that, I was able to immediately, within 10 days, get on my bicycle, start riding, and then within a month, I was doing 350 kilometers of biking.
It's amazing.
So the procedure was a great success. I will say that my physical therapist was just amazed at the procedure and the scar that was left behind. He thought it was he thought Dr. Ricardo should have signed the scar because it was so well done. And when I would be doing therapy, his name is Joelho. Joelho would call other people in to look at my knee because the surgery went so well, and the scarring was just a piece of art, he said. So it was a very pleasant experience. I will say that again, the other part too that I think Dr. Ricardo is good at is it's not just a business; it's also a personal discussion. So a very personable, takes interest in the patient, and all those things factor into, especially being in a country you're not used to, having a procedure done by someone as he has done.
Okay, so how did you feel during all the process, from the beginning to the end?
Always comfortable and confident that I was in the right hands.
Okay.
And I don't know if maybe that's a statement that doesn't translate. Just confident that I had the right person who was looking after my procedure and my issue. I never once left that office thinking, this guy doesn't know what he's doing, or having any trepidation. It was always, like I say, complete confidence that he was the right person for the procedure. We didn't have any challenges, seriously.
Oh, really?
Yeah, I mean, it was just, a phenomenal procedure, and so much so that now I'm going to have the other one done.
Okay.
So, again, it just goes to the preparedness of, what Dr. Sousa set up for me, and all the preparation pre-surgery, and then, immediately after we started on a regimen of rehabbing the knee and doing exercises. So it was a very, very fast recovery.
Okay, it's nice to hear. Did you have preparation before the surgery?
Just meeting with all the teams of the specialists, the cardiologists, the blood people, the anesthesiologists, that he had set up all those appointments, and that was the prep. Unfortunately, I would say that part of the reason for the success also is having been an avid biker before the surgery, helped tremendously on the other side of the surgery.
Okay.
If you're going to have your knees replaced, I think you should start building up your quadriceps before the surgery, because you're going to need one to do the work for two after the surgery, and it helps with the rehab. I think people just go in and don't recognize, or ill-prepared. No, and he knew my exercise regimen before I stopped, as I was going through this. He knew I was an avid cyclist. Again, it's that interplay between the medical and the personal knowledge that he does really well, I think really helps translate into successful outcomes.
Okay, was there any memorable moment during your follow-up or treatment that you'd like to highlight?
The only one that was there was one in particular. The day I got released from the hospital, the third day, I happened to be with my wife walking on the street out here in front of our apartment on the river, and he was jogging by.
Oh, really?
And he saw me, and he's like, "Don't go pushing too hard, too fast." So
that's funny.
That was kind of funny. He happened to be, and he frequently jogs in front of our place here. So
yeah, that's funny. It was a funny moment, I'm sure.
It was.
What would you like to say to someone that may be in need of Dr. Ricardo's treatment?
I would say follow his guidance, trust his opinion, and he's just got the best. What's the word? He's always thinking of the best outcome for the patient. Again, with my process, he could have right off the bat said, "Let's go and do this." He said, "No, let's work through the process of eliminating," and I attribute that to part of the success of the procedure as well.
If you could describe Dr. Ricardo in one sentence, what would you say?
I would say highly professional and personable.